All right, well, good morning from New York City. I am Grace Sun, and I am the assistant professor in ophthalmology, the residency program director at Weill Cornell. And I wanted to thank Jacqueline for inviting me to join you guys this morning to talk about two of my passions, one being global ophthalmology and two, education. I wanted to kick off my session with a photo. And I don't know if you will recognize this, but this was the cover of New York Magazine a few years ago. And it's an aerial view of Manhattan after Superstorm Sandy, a hurricane that touched down and basically left all of Lower Manhattan in the dark. And I use this photo when I talk about global ophthalmology because I think it serves as a metaphor for literally having parts of our global population living in the dark, unable to see, and our role as ophthalmologists in terms of trying to alleviate that burden. So I'm going to get started talking to you a little bit about myself. As Jacqueline had mentioned, I was a Peace Corps volunteer, and I want to thank Parmi for giving that great slide about, going from an F to an A. I feel like my years as a Peace Corps volunteer was lessons about frustration, floundering, failure, and futility. But I want to make it into an A, and it was in Nicaragua where I decided that I wanted to be in medicine and try and make a difference through eventually ophthalmology. So I've spent some time working with Orbis as a volunteer faculty, as well as starting our program with Weill Cornell, our partners in Bugando, Tanzania. I'm trying to build an ophthalmology program there. So I think that it has been increasingly evident that our world is more interconnected and interdependent, and in this certainly era of COVID that has been striking in how we all need to work together. The definition of global health has really expanded over the last couple of decades, particularly in global ophthalmology. I think that we had envisioned maybe ophthalmologists going into parts of Africa and with our training in the West, go in and do cataract surgery or build clinics. But really the definition of global health and global ophthalmology has expanded. I came upon this one description: global health is an area for study, for research and practice that places a priority on improving health and achieving equity in health for all people worldwide. And I think that's evident in ophthalmology as we look, particularly for this audience, at the disparities in blindness and avoidable blindness across the globe. And I want to go back to one of the points that our previous speaker had mentioned, that global health really is starting in our own backyard. And here at Cornell, we are in New York City, one of the most global cities in the world. And there are clearly a large number of underserved, uninsured patients that have a lot of the dense cataracts that we see when we go abroad. So just want to emphasize that global ophthalmology doesn't necessarily mean getting on a plane. And most of you in the audience are very familiar with these slides of the prevalence of blindness that affects mostly our population in the developing world, and the fact that 80% of blindness is avoidable. What's more is that this map depicts that there's a disproportionate lack of ophthalmologists where they are needed most. So there are a lot of ophthalmologies here in the United States as well as in Europe, but less so in parts of Southeast Asia, for example, and sub-Saharan Africa. So my point here is that I think we in academics have a unique role, and we're uniquely positioned to address this burden of global blindness, because what we're experts at are education, it's in research, it's in building collaboration among institutions. So while we go abroad at times and are able to provide direct high quality care amongst our partners in Tanzania, what we really are investing in is building human capacity through skills transfer. We invest in our colleagues' education by going there and working alongside them in the operating room in the clinics, but also have them come here, and they've joined us in the academy as well as our own offices and operating rooms to enhance their skill set. We also focus on, as best as we can, building infrastructure in a much needed part of the world, partnering with a couple of different institutions in Tanzania, the University of Dodoma, which is the capital in Tanzania, and Weill Bugando. Tanzania is a country of 50 million people, and they have about 45 ophthalmologists. So there's a great need for ophthalmology around the world, and I hope that Jacqueline there and others inspire people to think about academic global ophthalmology as a potential career path and how to make that a part of your practice. We're also invested in creating academic partners. We have a medicine doc, he's med-peds trained, but he has helped lead us in terms of working with our ophthalmology colleagues to think about research and trying to get more information about ophthalmology in Tanzania. So that's also worked very well. And these academic partners are long-term relationships, and I encourage those who are going to get involved in ophthalmology globally to think long-term. So, as the previous speaker had mentioned, this has been a growing field in terms of global health, and more of our residents and trainees and medical students are interested in getting involved abroad. So much so that within the last 10 years, the ACGME finally approved international electives in ophthalmology to count towards graduation. So previously, people may have used their vacation time to participate in such activities, but now up to 1 month is allowed and can count towards your graduation, although the surgical numbers done and procedures done abroad are still not part of your graduation requirements. So in 2005, I believe, there was an initial survey sent out to program directors that had reflected that most programs actually weren't thinking about global health and global ophthalmology. And we repeated a survey 7 years later, and there was a great shift in the number of program directors that were developing resources and actually taking advantage of the new ACGME elective potential to do an elective abroad, and developing programs and resources for their trainees. So much so that there has been the creation of global ophthalmology fellowships as well, Emory being one of them, and there are a few others that continue to pop up for those who want to advance their training and incorporate this into their career path. One of the things to think about in your role in education is, why are we interested in global ophthalmology or global health? What is the motivation behind going abroad? Is it because we get to supposedly help people who don't have the resources to modern ophthalmic technology? Is it the opportunity to do surgery in a way that we are not able to do here? For example, there are not as many opportunities to do manual small incision cataract surgery. Or is it, you know, medical tourism where they get 3 to 4 weeks to go to do a safari? So the AUPO and the American Academy of Ophthalmology has partnered in trying to share best practices and develop a curriculum in global ophthalmology for residents as well as others who are interested in going abroad. So the AUPO is made up of chairs and program directors and other educators, and we have been putting on a breakfast with colleagues for the last few years to discuss best practices. Additionally, the American Academy of Ophthalmology has a number of resources that I'll go through for young ophthalmologists who are interested in going abroad. So those of us who are educators in the audience and those of you who are going through training understand that there are 6 competencies that we are training our residents in, and then in ophthalmology there's a 7th. So there's medical knowledge, there's patient care, there's professionalism, systems-based practice, practice-based learning. There are a lot of things to think about when we build a curriculum. So with this working group, we've developed a proposed curriculum for those who are interested in utilizing it that we'll post on the Academy website, as well as the AUPO toolbox for program directors. But for example, we've come up with objectives such as in patient care, how do we develop an understanding of health access inequities, and then also learn to be a patient advocate in minimizing these disparities. In medical knowledge, developing familiarity with the presentation, the treatment, the diagnosis, and management of common infectious diseases in developing countries. Of course, when you go abroad, there's a competency in interpersonal communication skills. How do you develop cross-cultural cross-cultural knowledge and effective communication skills in the face of language and cultural barriers? And in professionalism, this is a huge one, understanding the ethical issues posed by global health initiatives, including the role of trainees in providing healthcare and the quality of care that is delivered. And in practice-based learning, one of the objectives is to recognize those challenges that come up when conducting clinics and surgeries in local areas, and how to do so in a safe and efficient and effective manner. Systems-based practice, of course, is a broader perspective, but how can we reflect on the social, political, and economic influences on eye health? And of course, our 7th competency in ophthalmology is related to surgery, and there's a module on manual small incision surgery that can be part of this curriculum. So we've been working on this as a group for the last couple of years, and it's finally coming into fruition. So I'm excited about that. Now, the Academy has a number of initiatives for young ophthalmologists who are interested in going global. There is an international subcommittee that I chaired a few years ago, and it has 2 missions. One, working with young ophthalmologists abroad to help them create their own organizational structure. But 2, also, how do we provide resources for our own young ophthalmologists who are interested in global ophthalmology? So I'd encourage our trainees and young ophthalmologists to get involved in an international subcommittee, and Jacqueline is one of our newest subcommittee members. There are a lot of resources that are available just on the Academy website. There's something called the Go Guide where you can click on a region and learn more about that particular region and what's affecting eye health there. There are multiple courses that Jacqueline and I are working on in terms of building a learning plan for residents to go through before they go abroad, for example. There are also resources. If there is an Academy meeting this year in person, I would encourage young ophthalmologists to go to the courses, one being Yo's Serve Globally, How to Get Started Now. Meeting with an international expert is a networking event where you can meet people like Jeff Tabin, who is from Himalayan Cataract Project, or people like Rich Abbott, who has served as a secretariat for Global Alliances. This is a great event in the Yo Lounge, and there are several networking events where you can meet young ophthalmologists from around the world. There's also breakfasts with the experts, and last year Jacqueline led an effort to do a special session called Global Ophthalmology, an emerging field, challenges and pathways to impact. So there's a lot of global ophthalmology resources out there in the Academy, both live if there's a meeting, but also on the website. So I wanted to thank all of you for listening, and I hope that you have been able to get a taste of the resources that are out there in global ophthalmology, what we're doing for our community as educators, as program directors, to elevate the importance of global ophthalmology and the unique position that we in academics have to alleviate that burden of global blindness. Thank you.